This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. Hi, this is Dr. Deepak Megur, and today I'm with another of my vlog series wherein I'll be showing relatively unedited videos here. And this is a 65-year-old lady where I'm planning to show you a horizontal chop technique. So the case is being done under topical anesthesia. I've stabilized the globe with the fixation ring, and the side port incisions are created using an MVR blade. Again, I always ensure that it is the posterior limbus because the tissue is quite thick here, and I also ensure that I have a nice tunnel there. I'm using intracameral oculan, that is anesthetic 1% preservative-free lignocaine under the air bubble, under which I'm again injecting some dye, which is then washed off. So this is usually my strategy. So even in cases of immature cataracts, I find myself often using a trypan blue. The patient is quite comfortable here. Again, I'm performing the main incision, stabilizing the globe. I'm using a 15 number blade to make the initial groove. And using a 2.8 millimeter keratome, I'm trying to create a tri-planar incision. So incision is done, and I just want to remove those air bubbles before I start doing my rhexis. It's important for me to stabilize the globe with some instrument to my second hand. In this case, I'm using the Senski hook to stabilize the globe. The patient is asked to look at the light. The capsule is punctured with the needle, and then it is folded on its own, and then the tearing is begun in a circular fashion. This is how I do when I'm using a needle, and this is clockwise, which is not the usual way which is usually taught. But this is the way I have learned it, and I most often than not do this clockwise tearing of the rhexis. So I'm aiming at around 5.5 millimeter of rhexis. It's quite challenging to size the rhexis accurately, especially when we are having a very big pupil as in this case. So I'm just relying on my mental marker to assume that this is 5.5 millimeter. The capsule is lifted up and a hydrodissection is performed, and just tap the opposite quadrant to let out the fluid which is there. I'm just trying to do a hydrodelineation, just trying to ensure that I'm able to see some amount of golden ring there. Yeah, it is there, but the endonucleus also is quite big here in this case. When I'm planning to do a horizontal chop, I usually want to do the hydrodelineation simply because we have an extra layer of cushion in the form of the epinucleus, because the chopper is going to go to the periphery and it just gives a little bit of a cushion. So when I'm planning to do a horizontal chop, I invariably ensure that I have done a hydrodelineation and I have a ring of epinucleus which is protecting the posterior capsule from an accidental trauma because of the chopper. So this is a Chang chopper which is very long and has a finger-like curve. So this design is extremely beneficial because we would want to hook the equator of the nucleus. The initial epinucleus is just being aspirated. The settings are changed to chop mode where only longitudinal energy is used. The phaco tip is buried into it and The chopper has gone in and hooked the equator of the nucleus, and both the instruments move towards each other. The first chop is initiated. You can see the chopper goes under the capsule and then hooks the equator of the nucleus. The first piece is pulled out of the bag and then emulsified at the level of the pupil. Again, you can just pull the nucleus fragment, chopped and emulsified. I'm just trying to trim a little bit of epinucleus here. The nucleus is rotated. The second heminucleus is relatively much more easier to chop because you can pull it and see the equator and then pass the chopper beyond it and then crack it. So the horizontal chopping technique is extremely efficient and physiological. The only issue here is the beginners might find it intimidating to pass the chopper under the rhexis and beyond the equator, because that is the key here. The chopper has to go and hook the equator of the nucleus. If you can do that, then it becomes an extremely easy technique. The epinucleus is then aspirated out. So the nucleus management could be finished quite easily and fast. I'm blowing the posterior capsule just to flush out any lens particles sticking onto it. Time to aspirate the cortex, and I typically use the bimanual IA system. You can see that as I'm trying to aspirate, the movement of the probe is tangential, horizontal. It's just ensuring that I'm trying to strip the cortex in a tangential fashion. This will ensure that accidentally, even if we catch the anterior capsule, the zonular stress is minimized. So that's the idea of trying to have this tangential movement. The hands are switched, and similarly the remaining part of cortex is aspirated out. So the bag looks alright and quite clean now. I'm just again going back and trying to flush the posterior capsule and try to remove some of the very small and minute lens fibers or particles which are sticking onto the posterior capsule. Intracameral antibiotic is injected into the bag once, and this is cefuroxime. I'm injecting a hydrophobic single piece lens using irrigation as the tool, and the bag is formed by the BSS itself. I'm supporting the irrigation device above the lens so that it doesn't come out of the bag. So the distal haptic and the optic have all been inserted into the bag. The trailing haptic is then dialed into the capsular bag. I'm just trying to ensure that the lens is well centered. Just trying to remove a last bit of cortex and trying to polish the anterior capsule there. In the beginning I was aiming at a 5.5mm rhexis. It has turned out to be quite well centered and appropriately sized. So we have got a rim of rhexis covering 360 degrees of the optic of the lens. When doing hydration, care is taken that the direction of the tip is more anterior to prevent any accidental Descemet membrane detachment. That's it, the case is done, and this is the first day post-op picture. Thank you for watching and hope you found this helpful.